My name is Clayton Bossier. I'm 48 years old. I'm a nurse practitioner at Lady General Hospital in Cutoff. And I was diagnosed with chronic myeloid leukemia 3 months ago at 48 years old. Yearly, I do my annual wellness blood work, looking at things like cholesterol, blood sugar, A1C, those types of things, screening for diabetes. And had an unexpected abnormal lab on my blood count. My white blood cell count was almost 80,000, which as a family nurse practitioner, I know is very concerning. Knowing that, I was able to get a oncology referral right away. It was scary, I tell patients all the time that they may have cancer, but it's just a little different when it happens to you. The first thought I had was, am I gonna die? It's scary. There's fear. Anger, as somebody who, I like to try to take care of my body, watch what I eat, do the right things, and this still happens. So there was anger, a lot of anxiety, because you plan on living to be old, you plan on your future, and then all of a sudden that's all up in the air. You start thinking about what happens if. Being in the healthcare setting in family practice, I knew what my most likely diagnosis was, but at that point I stopped becoming a healthcare provider. I became a patient, and so even though I know about the disease, the treatment, I'm just glad I had somebody to help me through this process. The treatment's going well. So actually we use something called a TKI. It's a targeted type of therapy to target the leukemia cells, and it's going well. Right now, I am what we call it in a hematological remission. I will be getting blood work in the next week or two to see how that's progressing as far as remission from a molecular level. So, that's going to be an ongoing process. That's going to take some time, but everything's going well right now. I do refer a lot of patients to Thibodaux Regional, the cancer center. I have confidence in Thibodaux Regional. I have confidence in their oncology staff. I've referred, like I said, many patients. They've always treated my patients well. They've always treated them well. And so if it's good enough for my patients, then it's good enough for me. And so far I've been extremely pleased with the care I've received from Thibodaux. The first thing I want to tell people is that do your wellness exams, do your screenings. A lot of times these cancers are not symptomatic until it becomes a bigger issue. Even though you feel fine and have no symptoms, I had no symptoms, I felt fine. It was just routine blood work, a yearly blood work. Had I not done, this could have gone on undetected for a year, 2 years, 3 years, until I started showing symptoms of this disease. So I know it takes time out of your day. You have to go to an office, you have to have a procedure, but it's worth it. If you do get this type of diagnosis, I think there is hope. Advancements in medicine have come along so far over the last several decades that you have previous cancers that may have had a very dim overall survival rate 20 years ago, have a very favorable survival rate now. And so I think it's very important that people realize this. I think even with the leukemia that I have, the chronic myeloid leukemia, before the late 90s, it was pretty grim too. But because of medical advancements, people who respond to therapy can have a near normal lifespan. And so that just shows you how far we've come.